There's two sections left here. There's medical treatment for obesity. Of course there is. There are medications that you can take. How many of them? There are 37 medications. That's insane. 37 approved by the Federal Drug Administration, right? For weight loss or weight management. Xenical, Casemia, Belviq, Contrave, Saxenda, I believe is how it's pronounced. These are some of the most common ones. Ally is another one that's pretty common. Ally helps to prevent fat absorption in the body, so that manages weight loss that way. Xenical is called Orlistat. It blocks the fat that you're eating. Again, it kind of works like Ally in that regard. Casemia is it's basically an appetite suppressant. It's basically similar to an amphetamine. So it makes food feel less appealing, makes you feel full. Actually, Casemia makes food not look attractive to you. So it affects your brain. Belviq interacts with brain receptors that are serotonin-based receptors to increase satiety. One of the massive side effects of Belviq is that causes massive headaches. Like I had a patient and he was on Belviq. He had massive migraines from day one. And as soon as you take one pill of Belviq, you can't just stop taking it. It's like a drug, and the brain gets dependent on it because it's stimulating those serotonin receptors. So then you have to do basically a step down approach, which is like basically getting off drugs. So you have to take it for such a period of time, even if you only take it once and you feel like you're going to die. Contrave suppresses appetite. Again, it affects the brain. Saxenda is similar to a hormone that the body produces to help control blood sugar, insulin levels, and digestion. I think it's injectable, though. I think all the other ones are pop a pill. But what would I ask about them? They basically all affect the brain. To either make food less appealing, increase satiety so you don't go find food. Xenical blocks fat absorption, blocks fat absorption, ABS absorption. And Saxenda, I don't know, I can't remember how to pronounce that one off the top of my head. This one's injectable. This yeah, helps control blood sugar, insulin levels. In the blood. This is an appetite suppressant. They're all appetite suppressants. These are all appetite suppressants. Actually, I believe in Saxenda. I'll pronounce it a third time a different way. Appetite suppressants, SUP, suppressants, suppress. It's injectable. They actually do use that one in individuals who are overweight and obese. And for that one down there, the SAX, I'll call it this time, I think it's actually shown to be positive in those two groups of individuals to be an appetite suppressant. So that one's newer on the market for me. So I've never dealt with anybody with that one. I don't have any interaction with that medication with any patient of mine. So Casemia, Belviq, Contrave, I've seen all those, and it has not been effective for those individuals at all. Aside from drugs, man, are also bariatric procedures. Bariatric procedure is where we manipulate the stomach. And if we affect the stomach, if we affect the change of the stomach, change its size, if we make it smaller, it fills up faster, you eat less. There you go. We have, as you can kind of see, 1, 2, and 3 major types of bariatric surgical procedures. We have we have the gastric sleeve, which you can see right here. Okay. I'll put a B above it. Okay. With the sleeve, you obviously are removing a vast amount of your stomach. It doesn't affect absorption. Not affect absorption. Okay. It does not affect absorption. So it's not going to affect calories. From that standpoint, it will cause you to reduce a little bit. Okay. It will cause you to reduce a little bit just because your stomach's naturally smaller. The Roux-en-Y gastric bypass is right here. I'm going to put that as A. With this one, this greatly affects how much you put in. Your stomach is about the size of your thumb. I knew a person who had this type of gastric bypass, and it limits the amount that you can drink. It limits the amount of food that you can eat. With this individual, she basically could have 2 bites of a typical steak, and that was it. She was full. So, I mean, this is going to affect not only the amount that you eat, this is going to affect absorption. As you can kind of see, you are bypassing the vast majority of the stomach. You're bypassing part of the stomach where we have a ton of secretions in that pyloric region. You are also bypassing the duodenum. The duodenum is where we get all of our bile, our pancreatic secretions dumping into. Cholecystokinin comes in this region right here. Stimulates the stomach to slow down its emptying. Well, we don't really have to worry about that, right? I mean, if your stomach is as big as your thumb, that's not a whole hell of a lot of food. So this affects an amount of food that you can consume or drinks that you can consume. And you have fewer or limited absorption capabilities. You're not breaking down proteins as effectively. You're not breaking down nutrients as effectively as you're bypassing the damn duodenum. The last one is the gastric band, and that one is what's left. And I'm going to put it as C. That's right there. With this one here, with gastric banding, you can restrict the amount of food that your stomach can hold. As you can kind of see there, you can insert saline, a solution, into this tube, into this port here, and that can constrict the you can restrict the size at which your stomach can expand to accept food. So with this one, you decrease the amount that you can consume as well. Decrease amount consumed. And so you feel fuller sooner. Fuller, that's fuller, F-U-L-L-E-R, good Lord, sooner. It doesn't reduce absorption of calories or nutrients. So of the two there, the sleeve and the gastric band, they do not affect absorption. Okay. They affect amount. obviously, they all do, but it does not affect absorption. The only bariatric procedure that affects absorption of nutrients, which can cause malnutrition, is that Roux-en-Y gastric bypass. So there you go. I may ask which ones affect nutrient absorption. Roux-en-Y gastric bypass. Which one affects how much you consume? Hell, they all do. One with a gastric band, one by cutting and removing the vast majority of your stomach, and one removing your stomach and the proximal portion of the small intestine, i.e. the duodenum.